Diphenhydramine, the active ingredient in Unisom Capsule, is an antihistamine that helps relieve symptoms of allergy, hay fever, and the common cold. These symptoms include rash, itching, watery eyes, itchy eyes/nose/throat, cough, runny nose, and sneezing. It can also prevent and treat nausea, vomiting, and dizziness caused by motion sickness. Additionally, diphenhydramine can help you relax and fall asleep. This medication works by blocking certain natural substances in your body that cause allergic reactions and symptoms like watery eyes and runny nose. It is important to note that cough and cold products containing diphenhydramine are not safe or effective for children under 6 years old, and some long-acting tablets/capsules are not recommended for use in children younger than 12 years. To use Unisom Capsule safely, it is crucial to carefully follow all dosage directions and not use the product to make a child sleepy. It's also important to avoid giving other cough and cold medications that might contain the same or similar ingredients. If you have any concerns about relieving cough and cold symptoms, it's best to consult with your doctor or pharmacist for alternative methods, such as drinking enough fluids, using a humidifier, or using saline nose drops/spray. When taking Unisom Capsule, always follow the directions on the product package or as prescribed by your doctor. You can take the tablet, capsule, or liquid form with or without food, using a special measuring device for liquid forms. The dosage will depend on your age, medical condition, and how you respond to the treatment. It's important to read the dosing instructions carefully for each product, as the amount of diphenhydramine may vary between brands and forms. If you're taking Unisom for motion sickness, take your dose 30 minutes before starting the activity. For sleep, take your dose about 30 minutes before bedtime. If you continue to have difficulty sleeping for longer than 2 weeks, make sure to contact your doctor. And as always, if your condition does not improve or worsens, be sure to inform your doctor. If you experience drowsiness, dizziness, constipation, stomach upset, blurred vision, or dry mouth/nose/throat while taking Unisom Capsule, it is important to tell your doctor or pharmacist. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. Your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Many people using Unisom Capsule do not experience serious side effects. However, you should contact your doctor immediately if you experience any mental/mood changes, difficulty urinating, fast/irregular heartbeat, or seizures. Seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed, it is best to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. Before using Unisom Capsule, make sure to inform your doctor or pharmacist if you are allergic to diphenhydramine or any other similar medications. Also, let them know about your medical history, especially if you have breathing problems, high pressure in the eye, heart problems, high blood pressure, liver disease, seizures, stomach/intestine problems, overactive thyroid, or difficulty urinating. This medication may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol or marijuana as they can increase these effects. Do not drive or operate machinery until you know how this drug affects you. If you are using marijuana, talk to your doctor. If you are planning to have surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Some forms of Unisom Capsule may contain sugar and/or aspartame, and some may also contain alcohol. If you have diabetes, liver disease, PKU, or any other condition that requires you to limit these substances, consult your doctor or pharmacist about using this product safely. Children may be more sensitive to the side effects of this medication, and it can cause excitement in young children instead of drowsiness. Older adults may also be more sensitive to the side effects, especially drowsiness, dizziness, confusion, constipation, or trouble urinating. These effects can increase the risk of falling. If you are pregnant, use this medication only if clearly needed and discuss the risks and benefits with your doctor. This drug can pass into breast milk and may have undesirable effects on a nursing infant, so consult your doctor before breastfeeding. It's important to be aware of any potential interactions with other medications or products that may cause drowsiness. This includes antihistamines applied to the skin, opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, and other antihistamines. Make sure to check the labels on all your medicines and ask your pharmacist about using those products safely. Additionally, this medication may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using this drug. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call 1-800-222-1222, and in Canada, residents can call their provincial poison control center. Symptoms of an overdose may include severe drowsiness, seizures, and widened pupils. In children, you may notice mental or mood changes such as restlessness, irritability, or hallucinations before drowsiness occurs. It is important to keep all medical and lab appointments. This will help ensure that your doctor can monitor your progress and make any necessary adjustments to your treatment plan. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to Unisom capsules, it's important to store them at room temperature and away from moisture and light. Make sure to keep them out of the bathroom and don't freeze the liquid forms of this medication. And of course, always keep all medications out of reach of children and pets. When it comes to getting rid of any expired or unused Unisom capsules, it's important to not flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to discard this product. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.